Thank you very much, Joe. The New York State Department of Health announced its selections for 5 organizations to be issued registrations to manufacture and dispense medical marijuana.
And I spoke with a local man who consulted for one of the losing applicants, and he says it's harder to break into the medical marijuana business in New York than one would think. Medical marijuana is one step closer to being in the hands of those who need it in New York State. 5 organizations were given licenses by the Department of Health on Friday to be under the state's medical marijuana program. But the path to get the license wasn't cheap or easy.
It's so strict that even Wall Street people that are interested in this industry don't want to touch New York.
Joseph Calderon is a consultant for one of the 38 applicants not chosen to grow, manufacture, and dispense medical marijuana in New York State.
Every group has to be vertically integrated from seed to sale. So that means that they have to be compliant for every detail from when that seed breaks into a plant to the end product.
Each applicant had to pay a $10,000 non-refundable application fee, and if chosen, $250,000 for the license and a $2 million bond. And of the 5 organizations chosen, only one will have a medicinal cannabis dispensary in the southern tier. Through Empire State Health Solutions, patients can receive the drug in Broome County. But there are none in the immediate area.
The regulations themselves have picked winners and losers. A group that is only backed by tens of millions of dollars would be able to even consider applying for a license.
Calderon says in states like Washington, Colorado, and California, facilities get allowances to grow marijuana. But in New York State, he says it's on the dime of the organization to maintain the growing operation without any insurance. And as for the patients, in order to be eligible for medical marijuana, you must suffer with diseases such as cancer, AIDS, Lou Gehrig's disease, and epilepsy. And the marijuana will either be eaten or vaporized, but not smoked. And Calderon says if New York State reopens the application process, he hopes one would be picked for the counties in our region.